We'll be speaking about transdisciplinary approaches, especially in their relevance to global health and health access. So the topic for this discussion was one that was very carefully selected, and it really stemmed from the students of the program recognizing the need to emphasize the global aspect of health. So when we speak about putting the global back into health, it's not just in the traditional geographical sense of crossing national borders, but we really are trying to embrace the notion that global health is a very holistic field, which should cover many different disciplines, many different sectors, and also different stakeholders, because all of these interact very closely and both create and influence the challenges that we see. We can acknowledge that health issues today are a result of a myriad of different factors that are not just biological, but they're also social, they're psychological, they're economic, political, and it's also the interaction between these different factors that give rise to the challenges we face. So within this complexity, it's important to note that also holds the potential for change and for innovation. So that's what we want to address during the discussion today. Through the discussion, I hope we can bring forth some insights on the relevance of transdisciplinary work to improve health access and also in terms of knowledge translation. Our discussion will also explore the challenges, like some of the challenges Debarati mentioned today, and also touch on strategies going forward. So the majority of the discussion is going to be within the panelists, but I really want to open up the discussion to the audience, especially towards the end. The online forum that you used to ask Fiorella questions before will also be open, and you can send in your questions throughout the discussion. At the end, I will address them. So now let me introduce you to our panelists. So our first panelist here is Kurt Engelin. Commander Kurt Engelin is a commander in the Belgian Navy and a defense counselor at the permanent representation of Belgium to the EU. Along with his political experience, Kurt is also an academic. He's currently a research fellow at the Center for Security and Strategic Research of the Latvian National Defense Academy. He's also a lecturer in international politics at the Belgian Royal Military Academy and the Riga Graduate School of Law. Our next panelist, Kashi Karaso, is a public health professional with a pharmaceutical background. Kashi has over 2 decades of experience working in different capacities on strategy, implementation, and evaluation of health programs. Her focus is largely on procurement, supply chain management, and access to quality medicines. She's also a lecturer at the London School of Hygiene and Tropical Medicine, the Royal Tropical Institute in Amsterdam, and the University of Rwanda. Our next panelist is Elise van Bel. She's a medical doctor and the Director General of MEMISA, a Brussels-based NGO. Formerly a general practitioner, Elise has specialized in tropical medicine and public health. She has worked extensively in different countries such as Afghanistan, Angola, Ivory Coast, and Congo, and also with different organizations like the MSF and Enable. Her work has centered around primary healthcare and strengthening of health systems. Debarati Guha Sapir is, of course, a familiar face as our keynote speaker. She was the director of the Center for Research on the Epidemiology of Disasters and a professor at the University of Leuven. She has a PhD in epidemiology and brings a wealth of experience in field research in humanitarian aid. She has worked closely with the WHO, the UNHCR, the European Commission in various regions all around the world. Her work has been a mix of academia, policy, and fieldwork. She's also actively engaged with national governments and major donors to change policy and improve the impact of humanitarian aid. So as you can see, our panelists bring diverse experiences and expertise to the table. So I'm really excited to have this discussion. I'm going to get a little more comfortable and sit down. So Elise, if I can call on you, maybe to get the ball rolling, as someone who has a lot of experience working in the field, could you reflect on the relevance of transdisciplinary approaches and how it would improve health outcomes?
Thank you. Well, there's so much to say. Maybe first, the reflection I had during this whole discussion and the very interesting presentations is to maybe make a difference between all the approaches and transdisciplinary approaches we need to make health services function. In this context, in Belgium, there are still gaps. There are still things that are not functioning perfectly well, but it's not comparable to what we see in many low resource settings where the health services have really difficulties to deliver basic health services. So that's completely something else than looking at how do different sectors, which approach do we need to make different sectors contribute to health in general. If we look now at climate change and at the different challenges in our society, they're all very important for health. But let's not forget that services have function first. And maybe to give an example from my own work and my own experience, 3 important things to make health services function: people, people, and people. You cannot deliver healthcare if you don't, first of all, have proper education, proper working conditions, a salary, an environment in which your children can go to school and in which you have a minimum of economic activity, etc. So to link sectors, I work in the health sector. We work mostly in Africa. We try to reinforce local health systems, so the public health services, hospitals, health centers, the staff of all these, the medical staff, of all these health infrastructure. When I started working, or when I was working in Africa about 10, 15, 20 years ago, one of the big problems was there were not enough people. When I was in Angola, I worked as a medical doctor in the hospital because there were no doctors. After 27 years of civil war, there were no doctors. They didn't train doctors for 27 years. Today, that's not the problem. There's more a plethora of medical staff, certainly in the cities. So there's a discrepancy with the rural areas. But the training is such a huge problem, the basic training. And we have a big program. We work with specialists, universities everywhere in Belgium, but also in Africa, to try and improve the training. So this is about continuous training, about practical training, training on the spot, hands-on training, because we have no leverage at all on the basic training, on the training of doctors, nurses, midwives, etc., because that's another sector and we don't work together. So there we come to how do you work together? How do you, we all love collaboration until we have to collaborate. We all love complementarity until you have to acknowledge that someone else can do something that you're doing actually quite a lot better. So for me, that's one of the big challenges. How should the health sector collaborate better with the educational sector? It's because it's not about continuous training. It's the basic training first, and of course also about continuous training. And I'm not saying, please don't misunderstand me, that all trainings are bad in Africa or anywhere else, but there is a problem. There is a problem that there are, if you have a classroom with a capacity of 500 and you have 5,000 students enrolled, there is a problem. There is a governance problem. If you don't have lecturers that are properly trained, and so on and so on. So, I don't remember what exactly the question was. That was one of the things I thought was really important, the education and the people, the motivation of people. You need people to deliver healthcare, but also all the other things. You have the evident sectors like water, electricity. You need the collaboration between all the different sectors to have the minimum. But we don't have the situation where hygiene, for example, about 100 years ago, before penicillin was invented, one of the most important elements to fight disease was hygiene. That is not the question anymore, and it's not the question in Africa either. They also have penicillin, and that's not the issue. It's about other things. As we said, it's about the challenges of climate change, the challenges of population, the challenges of violence, etc. To give just one other example of what, in my interpretation, because I'm still a bit in doubt about the right comprehension of the transdisciplinary approaches, is when I did my public health, master in public health, it's 10 years ago in the other big program in Belgium, in Antwerp, in ITM. I worked, or I did my thesis on mapping. I worked in Congo. I had the opportunity, it was a bit of a coincidence, to start working on a completely different sector, the geographic information systems. But it was so interesting. I discovered a whole new world, because we try to organize health services in an area which is a third of the size of Belgium. And one team is supposed to organize the health services there, but they don't have a map. They don't even know where the population lives, where are the rivers, the bridges, the towns. They have so little information. So we started mapping with GPS, with satellites. This was when I worked with Enable, and I see that the director just entered. So this was a fantastic opportunity, which normally you don't have, because doctors don't work in geographic information systems. But I learned so much, and I recognize that I'm not an expert in it, but there's no need. But there are already experts. So this was a perfect collaboration, which turned out very well, and we had beautiful maps of many areas in Congo that are still used.
Thank you, Elise.
Introduce.
No, that was really good. And yes, you did answer the question. And that was with a very fantastic example about how geographical discipline can also be integrated into health to help us understand the issue. That was really nice. And you pointed out a very interesting challenge, which is about having transdisciplinary skill sets integrated when we do capacity building and training. And that's something I'd really like to come back to later in the discussion. Debarati, I know that you have a lot of experience with humanitarian aid, of course, and working with some communities who don't have access to health because of disruption to services. In this context, how do you think a transdisciplinary perspective would help these communities to access health?
Right. Yeah, well, a transdisciplinary approach in humanitarian settings. I mean, this is an exemplary setting in which several disciplines, I said this earlier on in the keynote, it's an exemplary setting in which different disciplines have to work together. Sometimes they don't, and then there is chaos, and then things don't go well, and there's a mess like after the Haiti earthquake. But it is a situation where many disciplines have to work together. It's an emergent situation. It's usually with sometimes tens of thousands of people who are in need of immediate shelter, immediate food, immediate water, all of those things. It's a very emergent situation, and it does demand a multidisciplinary, a transdisciplinary approach. I have to admit today that the whole humanitarian thinking has come a long way in 10 to 15 years. It has changed fundamentally. It has changed fundamentally. Before, as an epidemiologist, when I started this whole working at CRED and, developing CRED or establishing CRED, it was a joke. Disaster, Madame, vous créez des désastres. It said, Madame Disaster. I was called Madame Catastrophe. They did still call me that at this time. But, it was a joke. It was a joke. Because what was the joke? The joke was that what would an epidemiologist do in an emergency setting? What would an epidemiologist do? What would a sociologist do? What would an organizational guy do? I mean, all of these are jokes. Just let us emergency managers, emergency doctors get to the place. That has changed completely. When you see the big teams going out after a disaster today, you can be almost sure that there are medical doctors, there are nurses, but there are also epidemiologists that have become a sine qua non in some of these things. And you will see anthropologists. Those have become very much a part of the team. And today you will also see teams in this configuration. You will also see geographers, spatial guys, spatial people who come and do maps, you know, the kind that Elise was saying. I mean, she discovered this many years ago, but now it has become part of the team. So I would bring a very positive message to in humanitarian settings. The humanitarian settings, the response to humanitarian settings is moving very fast towards a transdisciplinary, multidisciplinary approach, and has done very, very well.
Indeed. Thank you. And speaking of the humanitarian setting, Kurt, our other panelist, has a lot of experience in health response in emergencies as someone from the military. Kurt, could you tell me, as someone who has a slightly a different perspective, it would be really interesting to hear, in your view, how you collaborate with the health sector.
Well, thank you. Thank you, first of all, for inviting me in this panel. Maybe a little bit out of my comfort zone, but then thinking again, maybe not so much, because the perspective might be different, but the health is the same. And just to frame a little bit, where does the military fit in a transdisciplinary approach? Well, I would tackle it that way. First of all, the added value of the military is derived either from their specific expertise in specific domains of medicine, or because they have logistic capabilities that are not so specific to the military, but that they have in larger numbers because they are used to go to places where you need that response. Or sometimes we are the only responder in the place because we are in a dangerous place where nobody else is present. Okay, so these are three different circumstances. Starting with the first one, there are some domains where, because of the specific military nature of operations, we developed specific expertise. Think about things like emergency medicine, where you need to do emergency traumatology, burn wounds, tropical diseases, because we operate all over. So when it comes to vaccination, I can tell you a lot of military medical personnel are very well aware of needs for vaccination. And that is all derived from the fact that we need to keep our soldiers and our sailors in a healthy condition and fit to do their job for fighting. The second category that I would point out is where we come more in support of other players because of the logistical assets that we can put at the disposal. Now, in this case, we could think of transport and transfer of large numbers of patients. Think, for instance, about the pandemic. Well, military transport assets, medicalized transport assets were used to transfer patients because operating far away, we have that logistical capability of transporting people over longer distances. Think about the floodings. We have field kitchens. We can deploy very rapidly under crisis circumstances. We have our own supply chains. We can bring food we can bring meals to people in a remote zone. But even in crisis situations, and especially as a Navy person, look at the United Nations and the food aid program. When there were ships sent to Somalia in the framework of the United Nations, well, the military was protecting the ships so that they would be able to deliver the food. So is it directly a medical competence? No, it's a military competence, but it comes in support of civilian operators who are deploying their forces. The third way is giving health, and I really speak about health in the broad sense of the word, and not only medical, to communities in places where sometimes military are the only responders that are present, because we are in a dangerous environment. We are in a war situation or in a crisis situation. Of course, we bring our medical assets and our field hospitals with us. And very often these field hospitals will also benefit local populations where or pending the arrival of other operators. It's not our first job, but since we're there, we will also use it. Military will provide not only medical care, but they will, as soon as possible, provide a safe and secure environment for other actors to deploy. In crisis situations where we have seen places where, and praise them, I really have a great admiration for people like Médecins Sans Frontières or the Red Cross or the NGOs, but there are circumstances where even they cannot stay because it becomes too dangerous. So there the military can provide them an environment where they can do the job. And then last but not least, but it goes to very different aspects, like military engineers can restore bridges and roads to access a water point. So these are really things that, and I know it's a little bit contradictory. You look at military and you do not think, you do not make the direct association between military and health, medical health and health in general fields. But for those militaries like myself who deployed in operations, we know that once we are in the field, we have, first of all, no other option than to cooperate and to see how we can support. And so I think I will keep it here, and I will be happy to go into the discussion.
Yes, thank you, Kurt. Indeed, it's really interesting because I think I can speak for most of my colleagues who come from the health sector. We don't often hear a very different perspective. So it's very enlightening. I'm wondering now when you have this kind of a team on the ground focusing on an issue and you have people with different skill sets, what are the main issues you need to keep in mind when training these teams so that they have the ability to tackle such a diverse problem? Kashi, maybe you could answer, though I'm opening the question to all the other panelists as well.
Yes, it's all right. Yeah. Yeah, maybe just to start with saying, you said that I'm working on medicine and procurement supply chain management, right? And I was reading the invite to this meeting, and the question for me really came: to what extent are we even really collaborating within the health sector? And of course, I'm working on not even access to medicine, supply chain medicine. Yeah, it's like the selection, quantification. Yeah, it can get a little technical or boring in that respect. And even within the supply chain itself, yeah, I don't know if any of you work in supply chain or access to medicine, but you have a famous graph of all different parallel supply chains for HIV drugs and for family planning drugs and so on. Yeah. So going towards, more collaboration within the health sector, and then going to
transdisciplinary, multidisciplinary, and so on is yet another step. And I really feel that there's a lot more awareness within donors and within the whole community for that. But also the donors are still very, very much focused on the budget lines and their own sector. You have this sectoral tribalism that they talk about. Yeah, so this is our money and so on. And I have to say, I'm working as a consultant and I go a lot to the countries, and I have to admit that I've never talked with other ministries than the Ministry of Health. Yeah, I've never been invited or talked to Ministry of Education. They might be in some kind of, big meeting, but as Professor said as well, running the risk of it becoming a little too shallow, a little too general, yeah, as opposed to kind of going in depth. And of course, a long time ago, it was the doctors going to the different facilities and kind of being, the little district hospitals and giving care. And when I applied with MSF 20 years ago, they said to me, no, we don't do anything with pharmacists. Yeah, so I was like, oh, okay. I applied again and again, and then finally I was accepted, but it really took a lot of, And it's so very different these days, huh? We work with HERA and consulting group. I don't like to say company group. And it was set up 30 years ago by 3 medical doctors. If you look at our team right now, the partners, we have about 16 partners. Less than half is medical doctors. We have gender specialists, we have economists and so on. And a lot of the requests that we get from donors, and a lot of it obviously is also donor driven, huh? Because where the money is what actions will be taken, right? A lot of the donors are asking for, we don't say transdisciplinary teams, we say multidisciplinary teams. Yeah, the framework contracts are talking about multidisciplinary teams, and we're now working together with a company in Spain. I think it's Spain, I'm looking in the back, yeah, which is focusing on climate change. Yeah, we work with leaving no one behind specialists. And also I was not too long, we were talking before we started, not too long ago, I was the team leader of a consulting on the supply evaluation of the supply chain in South Sudan for UNICEF, focusing on both health and education supplies. Yeah. And that indeed, as was said earlier, speaking or trying to speak the same language, yeah, and the different kind of, specificities of the sector and the people, and so is also mean that at one point we really need to be more and more specialized, hyper specialized, I would say, really know everything about a certain area. And on the other hand, you really need to be able to extend and broaden your scope. And I was actually this is the last comment. I don't think I've answered your question, but we'll get to that. It was really, really nice to see the Menti earlier and to see all the different backgrounds from people. Yeah, because you just said we're mainly health, but I saw a lot of political science. I talked to someone on physiotherapy in the break over there. I mean, and a lot of other disciplines behind as well. Huh? So I thought it was actually very enlightening to see my neighbor here, yeah, coming from a different discipline, to see that we're all together here. So, yes.
Thank you, Kashi. I'm glad you enjoyed the multi-transdisciplinary environment here. And indeed, this is exactly what the program is like. So I'm glad you experienced it.